As a part of thyroid awareness program, I've been asked a question: do all thyroid nodules require surgery? This is a commonly asked question because there can be a lot of causes for thyroid nodules. Most of the time, it is seen more commonly in females, and most of the time, they are benign nodules. Benign means there are no cancerous changes or the potential to become cancer changes are not seen in the thyroid. How do we determine this? We determine by doing something called an FNAC test. If a patient presents to you with a thyroid nodule, we ask them to undergo an ultrasound first, and the ultrasound will show what all changes are there in the nodule, whether it is a solid nodule, whether it is a cystic nodule which is filled with fluid, or if it has combined solid areas as cystic areas. And also, there are some changes which we can see in the thyroid which are more suspicious of predicting a cancer. So based on that, we actually ask the patient to undergo needle test or FNAC. FNAC full form is fine needle aspiration cytology, which will involve removing a small portion of the tissue from the nodule. Usually it can be done if the nodule is very palpable in the neck, it can be done directly, or nowadays most of the time we are doing it under ultrasound guidance. The radiologist will look at the thyroid gland through the ultrasound, and while he or she is looking through the ultrasound, they will put a needle directly into the nodule which is looking most suspicious or the biggest or some changes which you want to investigate further. This tissue is removed and then seen under microscope by the pathologist. That is called FNAC. Then the FNAC results are categorized into a lot of criteria. We call them Bethesda classification. If it is 2, that means if it is a benign nodule, that there is no chance, there is very less or less than 3 to 5% chance of the nodule becoming cancer. So in that case, if the nodule is small, say less than 4 centimeter, and it is in the thyroid tissue, it is not pressing on the windpipe, it is not pressing on the foot pipe, it is not causing any compression changes, then we can even leave the thyroid swelling alone, provided we have proven it is a benign thyroid nodule. But if your thyroid nodule has come something as indeterminate, or if it has come as the Bethesda level 5 or 6, which is suspicious or frankly malignant thyroid cancer, if it is shown in the needle test, then you require surgery. Benign nodules, all of them no need to be operated. If your doctor says you have a benign nodule and you need to operate, you have to ask them what is the question, what is the need for my surgery. If you the usually benign nodules are less than 4 centimeter and they are not big enough, they are not causing any compressive symptoms like difficulty in swallowing or difficulty in talking or change in voice or any other symptoms because of the pressure effects of the swelling, you don't need to undergo surgery. Cancerous nodule, on the other hand, most of the time will have to undergo surgery. There are some studies from Japan which says that the less than 1 centimeter cancer of thyroid, which is called micropapillary CA. Cancer of thyroid can be different kind. The papillary CA or the follicular CA of thyroid are called well differentiated thyroid cancer, which are very not very aggressive kind of cancer. If you are having that kind of cancer and it is a less than 1 centimeter nodule which has been proven by FNAC, you may not undergo surgery immediately. You can even wait and watch, because there are some studies which have recently shown that such patients with less than 1 centimeter thyroid cancers may do the same as that of a person without any thyroid cancer. But these patients require thorough follow-up, and if any changes happen in the nodule, or if it is becoming bigger, or if it is showing signs that the thyroid cancer is spreading to the lymph nodes surrounding the thyroid in the neck, then may require surgery. So it is a matter of surveillance. We need to keep